In this video, I'm going to talk about the Freudian Psychoanalytic Method, written in 1904. This paper is more of an instruction manual on how to practice psychoanalysis. At the beginning of the paper, Freud talks about the cathartic method, which was discovered by Joseph Breuer and used by him for about 10 years with a successful treatment of a hysterical woman patient. The name of the patient is not mentioned in the paper, but it was Anna O. Now, under the cathartic method, the job of the doctor is to remove the pathological symptoms, which is the traumatic experience stored in the body as physical symptom, such as a paralyzed leg, a blind eye, without any physical cause. The traumatic experience, a painful memory, is converted and transformed into a symptom. And in those times, the treatment used was the cathartic method, where the patient is hypnotized and guided to remember the exact moment the symptom first appeared. When the trauma is found, the patient abreacts it, which means relive it, and by reliving it vividly, the patient can finally release the pain of the emotional suffering. And under the cathartic method, the emotional energy is discharged, the trauma vanishes, it's quick like an operation, and the patient would go home cured without the symptom. Now, when practicing the cathartic method, Freud realized that a large number of neurotic patients could not be hypnotized, and by abandoning hypnosis, an unlimited number of patients could be treated. Freud also realized that hypnosis doesn't remove the resistance. For Freud, hypnosis is like cleaning the house, but putting all the mess under the bed. The house looks clean, tidy, and organized, but the mess is still there, so the cure doesn't last. For Freud, for the cure to be permanent, the patient needs to be awake, not hypnotized. So hypnosis is now no longer used, the cathartic method is abandoned, and Freud began employing a new approach called psychoanalysis, which this paper is very specific about. So in psychoanalysis, the patient lies down on a comfortable sofa, the psychoanalyst sits behind the patient, outside their view. Later, Freud admitted that he didn't like to be stared at for 8 hours a day, and then the conversation is between two people equally awake, and the patient is lying down on the sofa started to free associate. Free association means that the patient talks about anything that comes to mind, without any filter or fear of being judged. The patient is encouraged to let everything out. But free association is difficult, because free association is like going down to the basement. In this situation, it's getting closer to the unconscious. The more we speak, the closer we get to the unconscious, which is where the repressed, painful, and traumatic material are stored. By getting closer to this unpleasant and painful material, there is a force pushing us back, which is resistance. The closer we get to the unconscious, the more we resist therapy, according to Freud. And for this reason, Freud developed interpretation. So when a patient resists therapy by, for example, changing the subject by saying, I don't want to talk about this anymore, or feeling anxious, or start arguing with the analyst. So when a patient resists therapy, Freud recommends in this paper to use interpretation. Now, the paper also includes who psychoanalysis is recommended to. So psychoanalysis is recommended to people with obsessional neurosis, obsessive thinking, hysteria. Psychoanalysis is not recommended to those with acute hysteria, nervous exhaustion, because these people will not be able to free associate. Also, Freud in this paper says that psychoanalysis is not indicated to people over 50 because in his view, there is too much emotional baggage and change gets harder with time. It may sound ageism, but it was the genesis of psychoanalysis, and it was still being developed. And we now know that change is possible regardless of age. The paper also lays out the duration of the treatment, which is between 6 months to 3 years. And the goal of the psychoanalytic treatment is not perfection, happiness, but practical recovery, as Freud puts it. The aim of the treatment is to restore the ability of active life and the capacity for enjoyment.